you met, obviously, with the surgeon early on, and you had surgery. Did you have involvement at that point with a medical oncologist, or were you just with the surgeon guiding you through the surgical procedure first off?
I was just with the surgeon, and it was actually following surgery that the doctor, Dr. Bello, made a reference to Dr. Marshall as an oncologist. And he said, now we're going to begin your post-surgery.
And before we bring Dr. Marshall on to explain his input in your care, how was that presented to you? The surgeon talking about involvement of a medical oncologist. That was after the surgery, was it?
Well, it was after the surgery, and Dr. Bello indicated that he would continue to see me for the recovery of the surgery. But he said, always, we have an oncologist, because that is the person who really knows how to manage the treatment.
And was that because he was concerned that you still had residual disease that would require further treatment with an oncologist, or was it more for surveillance, just to keep an eye on you down the road?
Because one is never sure. And
did he know?
Yes, but he said that regardless, that we have an oncologist and that oncologist follows you.
And how soon did you meet with Dr. Marshall?
I think it was a month after. I was pretty well.
And in that initial meeting, you were expecting to have further treatment from Dr. Marshall, or were you expecting just to be under surveillance?
Well, there was an interesting conversation, because when I had gotten the word from Dr. Bello 5 days later that it was stage 2, and with stage 2, he said the chances of needing any further treatment are pretty minimal to almost non-existent.
So he'd set your expectation at that point.
So he set my expectation. And because I'm still working, I'm a faculty member at the University of Maryland, that I thought, no, I don't want any more treatment, because I've got a life to live and a lot of things to do. So when I went to Dr. Marshall, that first meeting with Dr. Marshall, I sat down and I turned to him and I said, I don't want any chemo. And so I said, whatever we have a conversation about, it will not include chemo.
Dr. Marshall, you're fired.
Yeah, Dr. Marshall,
on our
you're
first
fired.
date.
Exactly.
Yeah, first date. Yeah, I said, this thing isn't going to work out very well. So Dr. Marshall, in his very gentle way, and again, I had heard his reputation, he said, let's walk through the whole scenario. And so he started at the beginning and laid out all the probabilities, which is then why I know one needs to really have a good oncologist. And this is what it can be, and this is, so he laid out percentages, probabilities all the way through. And at the end of the conversation, he said, it's your choice as to what you want to do. And I said, okay, when do I begin?